Hello, my name is Emily Ghazarian, and this is my head-to-toe assessment for Advanced Health Assessment at Maryville University. This is Jason. He's agreed to be my patient today. For the purpose of this examination, I've had him put on a pair of shorts. I've asked him to empty his bladder. We've obtained a full set of vital signs, his height and weight, and we've also checked his optic nerve by checking his vision using the Snellen chart for distance and the Rosenbaum chart for near vision. I've washed my hands and we can now begin. I was able to assess Jason as he walked into the room. His gait was steady. He's able to answer all of my questions appropriately, and he's able to sit up and hold himself upright. Now I'm going to begin by assessing the head. First, I'm going to look at the shape. It's normocephalic. It's symmetrical. The eyes and ears are symmetrical in shape and number. There's no obvious masses or lesions. I'm going to go ahead and palpate the scalp. The scalp is freely movable. His hair is nice and soft and evenly distributed. There's no evidence of lice. There's no nodules or lesions. His skin is also even in color and texture. It's consistent with the rest of his body. I'm going to continue palpating his facial bones, checking for any swelling or tenderness. And then I'm also going to palpate his frontal sinuses here at the brow bone and his maxillary sinuses here at the zygomatic process. Next, I'm going to go ahead and check his light sensation. I've got a Q-tip here with a pointy end and a soft end. Jason, I'm just going to have you shut your eyes and tell me when you feel soft or sharp.
Soft. Sharp. Sharp. Soft.
Very good. Next, we're going to go ahead and move along to inspection of the ears. I'm going to go ahead and inspect the auricles. The auricles are nice and symmetrical. The top of the auricle is even in line with the inner canthus of the eye, which tells me that the ear is appropriately set on his head. I'm going to go ahead and palpate the auricles. They're nice and firm, but still flexible. Next, I'm going to go ahead and assess his acoustic nerve. I'm going to have him cover his ear. I'm going to go ahead and whisper a word to you, Jason. Go ahead and repeat that word to me out loud, okay?
Purple.
And on the other side?
Orange.
Very good. Next, we're going to go ahead and check cranial nerves 3, 4, and... No, I'm sorry. We're going to check his hearing using the tuning fork. First, I'm going to conduct the Weber test by striking the tuning fork, placing it on Jason's head, and seeing if he can hear the noise in both ears equally. And do you hear that noise in both ears equally, Jason?
Yes.
Alrighty, next we're going to go ahead and continue with the Rennie test. I'm going to go ahead and strike my tuning fork and place it on the mastoid bone. Just tell me when you stop hearing that noise.
No.
And again, I'm going to strike the tuning fork, this time placing it about 1 centimeter in front of the auricle. And tell me when you stop hearing that noise.
No.
Very good. And the air conduction should be about twice as long as the bone conduction, which is what we saw here, and that is within normal limits. Now I would repeat this particular test on the other side. Next, I'm going to go ahead and inspect the ear canal and the tympanic membrane using the otoscope. I'm going to pull the auricle up and out as I gently insert the otoscope into the ear canal. I can visualize the ear canal. It's nice and clear. There's no cerumen, drainage, or lesions. I can also visualize the tympanic membrane, which is nice and pearlescent. There's no bulging, drainage, or perforation. Noted. And I would also repeat this on the other side. Next, we're going to go ahead and move along to inspection of the eyes. Again, I can see that the eyes are symmetrical, the eyebrows are symmetrical, the hair is nice and soft, it's evenly distributed. His eyelashes are growing away from his eyeball, which is normal. His sclera is nice and white. I'm just going to pull down gently on the lower lash line and see his conjunctiva are nice and pink and moist. I'm going to palpate the orbit, which is nice and firm, there's no nodules, and I'm going to palpate the lacrimal apparatus, nice and soft, no bulging, and no drainage. Next, I'm going to go ahead and check his pupillary response using my pen light. checking for constriction of the pupils direct and consensual, which they are. Pupils are equal, round, and reactive to light. I'm also going to check the cardinal fields of gaze, the extraocular movements, by moving my finger in motion of an H. Jason, I just want you to follow my finger using your eyes. Do not move your head. And he was able to complete that. This also checks for cranial nerves 3, 4, and 6. Next, we're going to go ahead and do the cover-uncover test. I'm going to have him just cover his right eye with his hand. And I'm going to place my finger right here. Go ahead and focus on this point and remove your hand. And same with the other side. Go ahead and cover and uncover. And there was no strabismus or nystagmus noted in either eye. Next, we're going to go ahead and move along to the nose. First, I'm just going to inspect the general appearance of the nose. The septum is nice and straight. It's midline. There's no deviation from that midline. I'm going to go ahead and use my light to go ahead and look inside the nose. And I can see that the mucous membranes are nice and pink and moist. There's no blue coloring. There's no bogginess. The turbinates are nice and pink and firm, and the septum is intact. Next, I'm going to have Jason just go ahead and put his finger on one side of his nose, breathe in and out, and again on the other side. Very good. Now we can see that both nares are patent. Next, I'm going to go ahead and move along to assessment of the mouth. I can see that the lips are nice and soft. There's no cracking. The skin is intact. No lesions. I'm going to go ahead and have him open up his mouth for me. Using my light, I'm going to inspect the buccal mucosa, which is nice and pink and moist, the floor of the mouth, the roof of the mouth, the oropharynx. Go ahead and say ah. I can visualize the uvula, which is nice and midline, and it moves down when he says ah. The oropharynx is non-obstructive. He is moving air. His tonsils are intact. They are just past the tonsillar pillars, but not quite to the uvula, which is normal. There's no leukoplakia. Next, I'm going to go ahead and examine his teeth. All of his teeth are intact. He doesn't appear to have any decay. There's no cavities noted. The gum line is nice and pink. There's no bleeding. No chipped or cracked teeth. His teeth are nice and white. Next, we're going to go ahead and inspect the tongue, which is also going to allow us to check the hypoglossal nerve. I'm going to have you just go ahead and stick out your tongue for me. Move it from left to right. We're looking for any lesions. Looks really good. Nice and pink and moist. The tongue is freely movable. You can move your tongue up and down. So everything checks out there. Next, we're going to go ahead and check the glossopharyngeal and vagus nerves by checking his gag reflex. Go ahead and open your mouth and say ah. Very good. His gag reflex is intact. Next, we're going to go ahead and check the facial nerve. I'm going to have him clench his teeth, smile, stick out your tongue, puff out your cheeks, shut your eyes real tight, and wrinkle your forehead for me. Very good. So his facial nerve is intact. Next, I'm going to go ahead and palpate the temporomandibular joint. Go ahead and if you can just open and close your mouth, and we can see he's got good range of motion. There's no clicking or popping or tenderness as he does that. I'm also going to have you just bite down and flex that muscle, that masseter muscle, really good. Very good. And that also allows us to check the trigeminal nerve. Next, I'm going to go ahead and inspect the neck. The neck is nice and symmetrical. There's no bulging, no goiters. I'm going to go ahead and begin palpating. The trachea is nice and midline, just above the suprasternal notch. Also, I'm going to observe here that there's no jugular venous distension, there's no pulsations or bulging. I'm also going to palpate the thyroid, just between the trachea and the sternocleidomastoid. On each side, I'm going to have Jason swallow for me. And I'm able to feel that thyroid gland. It's nice and soft. It's equal on both sides. No masses are noted. I'm going to go ahead and palpate his carotid arteries. I'm going to go ahead and feel the trachea and move over about an inch, and the carotid should be right there, which it is. That pulse is nice and strong and even in rhythm and rate. Again on the other side. Very good. And while I'm palpating, I'm going to go ahead and palpate his lymph nodes, the pre-auricular, post-auricular, occipital, superficial cervical, deep cervical, post-cervical, tonsillar, submandibular, submental, supraclavicular, inclavicular, infraclavicular, and axillary. And we're not able to feel very much there because he's healthy right now, no infection, so those lymph nodes are not inflamed or enlarged. Next, I'm going to go ahead and auscultate his carotid arteries and his thyroid. I'm going to go ahead and use the bell of my stethoscope for the carotid arteries and the diaphragm for the thyroid, checking for any bruits as I go. Take a deep breath in, hold it. You can breathe. And I'm not hearing any bruits, which is very good. Next, we're going to go ahead and move along to assessment of we're going to check his range of motion and strength of his neck first before we move on. So I'm going to have you just move your chin to your chest and move it back, then from side to side, and left to right. Very good. So his range of motion is very good. Now we're just going to check his strength. We're going to do the same motions while you're pressing against my hand. And shoulder to shoulder. Very good. And now I'm going to go ahead and have you shrug your shoulders, which is going to allow us to check the accessory nerve. And then we're going to have you shrug against me. Very good. He's nice and strong there. Okay, next we're going to go ahead and move along and check the upper extremities. I'm going to go ahead and first assess them. I can see the skin again is intact. It's even in tone and consistent with the rest of his body. I'm going to go ahead and palpate. He's well muscled. I'm going to go ahead and check his brachial pulses, radial pulses, which are nice and strong, about a 2+. I'm going to check his nail beds. Those are intact. There's no cracking or splitting or fungus. And his capillary refill is nice and brisk, less than 3 seconds. I'm also going to check his arm strength. I'm just going to have you hold your arms up for me. I'm going to press down, press against me. Good, and the other way. Very good. Next, while we're here, I'm going to go ahead and check his brachioradial deep tendon reflex. I'm just going to have him relax his arm. As I hit that tendon, we should see a slight pronation of the arm. Very good. And on the other side, very good. Okay, moving right along, we're going to go ahead and move on to the posterior chest. I'm going to have Jason turn around so we can see his back. First, we're just going to do a general assessment. We can see that the lateral diameter is larger than the anterior-posterior diameter, which is normal. There's no lordosis or kyphosis. His spine is nice and straight. The skin, again, is consistent with the rest of his body in tone and texture. There's no lesions or nodules. I'm going to go ahead and just palpate his spine. I can feel his vertebrae. Next, we're going to go ahead and check for symmetrical expansion of the lungs. I'm going to place my hands at the level of the 10th ribs. I'm going to have Jason go ahead and take a deep breath in and out. And I can see that my thumbs move equidistant from the spine as he does that. Next, we're going to check for tactile fremitus. I'm just going to place my hands on his posterior chest as he repeats the words 99 repeatedly.
99, 99, 99, 99.
Very good. And those vibrations were also equivalent from side to side and throughout the regions of the posterior chest. Next, I'm going to go ahead and percuss the costovertebral angle. checking for any tenderness, and there is none, so that's normal. Next, I'm going to percuss the posterior chest, and I should be listening for a resonant sound. I'm doing this in a systematic manner, from side to side, comparing each side. And that tone is nice and resonant. I'm also going to have him place his arms over his head, and I'm going to percuss the lateral aspect of his chest. Again, in a systematic fashion, from side to side, comparing each side, listening for a resonant tone. Very good. Go ahead and relax. Next, I'm going to go ahead and check his diaphragmatic excursion. Jason, I'm going to have you go ahead and take a deep breath and hold it. And I'm going to percuss down the scapular line until I hit an area of dullness. Very good. You can breathe. I'm going to go ahead and mark that. Next, I'm going to go ahead and have you take a deep breath in, blow that out, and hold it. And I'm going to go ahead and percuss until I hit another area of dullness. I'm going to mark that. We'll measure that distance. It's about 8 centimeters, which is normal. Next, I'm going to go ahead and auscultate Jason's posterior lung sounds. Using the diaphragm of my stethoscope, I'm going to have him take a deep breath in and out, listening for any adventitious sounds like crackles, rails, or wheezes. Again, in a systematic fashion, comparing each side. Very good. Now I'm going to have Jason go ahead and turn around so we can inspect the anterior chest. As you can see, his respirations are even and unlabored. He's not using any accessory muscles to breathe. There's no pulsations, heaves, or thrills. I'm going to go ahead and palpate his chest. And while I'm here, I'm going to go ahead and palpate for the point of maximal impulse. It should be at the left midclavicular line, 5th intercostal space, and I am able to feel that pulsation. Next, I'm going to go ahead and percuss his anterior chest. Again, listening for a resonant sound. We may hear a little bit of dullness over the cardiac region. Percussing in a systematic manner, comparing each side. Very good. Next, I'm going to go ahead and auscultate Jason's anterior lung sounds. Again, using the diaphragm of my stethoscope, listening for any adventitious sounds, such as crackles, wheezes, or rails. Comparing side to side. Very good. I'm going to go ahead and listen to his lateral chest as well, comparing each side. Good. Now I'm going to listen to Jason's heart sounds, again using the diaphragm of my stethoscope, beginning in the aortic point, pulmonic, Erb's point, tricuspid, and mitral. And I was able to auscultate S1 and S2 sounds. No gallops, rubs, or murmurs were noted. Next, we're going to go ahead and move along to the assessment of Jason's abdomen. I'm going to have him lay down in a supine position for me. And as he's laying down, I'm able to note that his abdominal muscles are nice and strong, and there's no exposure of any hernias or superficial masses. I'm going to begin by assessing the contour of Jason's abdomen using my pen light. I'm going to shine that towards me and just look at the contour. It's nice and even. There's no bulging or masses, no hernias. Next, I'm going to go ahead and auscultate his bowel sounds. beginning in the right lower quadrant, listening for some frequent gurgling noises. And continuing on in a systematic fashion towards the rest of the abdominal quadrants. While I'm here, I'm going to go ahead and auscultate his arteries, the aorta, using the bell of my stethoscope, renal, left and right, iliac, and femoral, and that sounds good. I'm not hearing any bruits. Next, I'm going to go ahead and percuss his abdomen. Just in general, in the abdomen, we should be hearing a tympanic tone. Next, I'm going to percuss for the liver borders, beginning in an area of resonance until I hit an area of dullness, which indicates the upper border of the liver. I'm going to go ahead and mark that area. Then I'm going to percuss up from an area of tympany until I hit another area of dullness, which is going to mark our lower border. I'm going to go ahead and measure that. Just about 7 centimeters, which is within normal limits. I'm going to go ahead and attempt to percuss his spleen, which should result in a dull tone at the left costal margin. Good. Next, I'm going to go ahead and palpate lightly using one hand the abdomen, just checking for any superficial abnormalities, any masses, hernias, all the while checking Jason's face for any grimacing that may indicate tenderness. Now I'm going to switch to a bimanual palpating method, and I'm going to deeply palpate, beginning at the right costal margin for the liver. I have you take a deep breath, Jason. Hold that. And I'm able to palpate that liver. I'm going to go for the kidney next with one hand under his back, and he's going to hold that breath. I'm palpating that kidney and the other one. Then I'm going to have you breathe out, roll onto your right side. We're going to go ahead and attempt to palpate your spleen, which we're not able to. It's not generally palpable. Finally, I'm going to go ahead and palpate his aorta just to the left of the midline. And I'm able to feel that pulsation. Next, I'm going to go ahead and move on to the lower extremities. In just doing a visual inspection of Jason's legs, I can see that they are nice and well muscled. They're nice and warm to touch. The skin is evenly toned, consistent with the rest of his body. There's no lesions, no masses. I'm going to go ahead and palpate for any edema, which I don't feel any. I'm going to check his popliteal pulse, his posterior tibial pulses, and dorsalis pedis pulses. I'm going to go ahead and check his sensation using the pointy end of my Q-tip here. Can you feel that, Jason?
Yes.
And the other side?
Yes. Yes. Yes.
Very good. Okay, next I'm going to go ahead and check his deep tendon reflexes. Go ahead and sit up for me, Jason. I'm going to check the patellar reflexes. I'm going to go ahead and strike this area here, and we should be seeing a slight extension of the lower leg. Very good. And on the other side, very good. Next, I'm going to go ahead and check the Achilles tendon reflex. I'm just going to hold his foot gently, and as I strike the Achilles tendon, we should see a slight flexion of the plantar portion of the foot. There we go. Very good. Okay, I'm going to go ahead and just have you stand up for me. I'm going to have you go ahead and bend over. We're going to check his spine, thoracic and lumbar. He's got good balance, good strength. He's able to hold himself up. I can feel his spine, run my fingers all the way down. It's nice and straight, no evidence of scoliosis. Go ahead and stand on back up for me. And I'm going to have him do a squat for me. Very good. And we can see his strength and balance are very good. Go ahead and have a seat for me. And that concludes this assessment. Thank you so much.